Okay, now we are streaming on YouTube Live.
It started, I don't see it, but anyhow.
Okay, now we are streaming on YouTube Live.
Okay. Welcome, everybody. We are privileged on behalf of the Sub-Regional Office of South. Okay. Welcome. Good afternoon. Good evening, everybody. We are happy to welcome you all on this virtual high-level policy dialogue of South Asian cooperation for accelerating recovery from COVID-19 and bringing back better. A few logistics note. We are very happy that we have that 400 people who have registered for this room, which we are working on two modes. One is on YouTube and another for the moderator and the panelists here stream. May I request all moderators and the panelists to keep their cameras on, but they can mute their mic and the speaker. For those who are attending through the YouTube, we will be taking your questions and encourage you to type your questions or comments on the YouTube channels, and then we will pass it on to the moderator who will ask these questions to the panel. If you have a specific question to the panel, please mention that also. All these questions we try to accommodate. Let me first of all call upon Dr. Nagesh Kumar, Head and Director of the Sub-Regional Office of SNAP, New for South and Southwest Asia, for his opening remarks. Dr. Nagesh.
Thank you, Rajan. Friends, distinguished colleagues, it is a privilege to have you all on the screen, and very distinguished participants who are joining us at YouTube channel. I'm happy to welcome you to this virtual policy dialogue on South Asian cooperation for accelerating recovery from COVID-19 and building back better, hosted jointly by UNESCAP and the South Asia Center for Policy Studies, which is a network institution, as you know, combining and bringing together the Biruni Institute in Afghanistan, the Center for Policy Dialogue in Bangladesh, Research and Information System for Developing Countries in India, South Asia Watch on Trade, Economics and Environment, SOTI in Nepal, Sustainable Development Policy Institute in Pakistan, and the Institute of Policy Studies of Sri Lanka. So, and we are joined by the distinguished heads and executive directors of all of these 6 institutes, and co-chair of SASEPS, Professor Akmal Hussain. And we are very sorry that the other co-chair, Akmal's co-chair on the board of SASEPS, Professor Deepak Nair, is prevented from joining us by a family medical emergency. And we are also joined by, colleagues from Bhutan and Maldives. In Bhutan, we have Mr. Wangchuk Namge from Gross National Happiness Commission, very important organization guiding the economic policy in Bhutan. And we have Aishad Saad from Maldives government. She is a focal point in the government on SDGs, and she's a Deputy Director General of the Ministry of Planning. So with this very wonderful group of friends from all the South Asian countries, I'm really delighted that we can carry forward the discussion that we started on 9th of July with the planning ministers or economy ministers of all South Asian countries, in which we also had the Secretary Generals of SAARC and BIMSTEC join us. And if I could sum up that discussion, there was one single word used by everyone, that this is a major disaster, major tragedy or challenge faced by South Asia like no other. And we need to deal with it together. So we have to really work together to deal with it, address it, and come out of it better. So that was the message coming out clearly from all the ministers that spoke from all the South Asian countries. So we thought there is something in it, and we should continue this momentum and discussion and dialogue, because we need to really understand how we can cooperate and take this sub-region out of it. To get this session kick-started, I want to just share 4 key messages that came out of a report, a brief report that we put together at ASCAP on COVID-19 and South Asia, which was, I think, issued in the beginning of July. And of course, the way things are, taking shape, and every day there are new figures, new numbers coming up. So it is probably out of date by now, but the key messages remain relevant. And I thought of just sharing those 4 key messages from that report for this discussion. Of course, the first one is that the South Asia entered this crisis with a low level of preparedness, and that low level is in terms of the way the crisis exposed the gaps in public health infrastructure of South Asia, the basic infrastructure such as sanitation and the ICT connectivity, which are, by the way, all of them are SDG targets. So if we were doing very good progress on SDG achievement, then possibly we could have handled this crisis better. The poor coverage of social security of the workforce because of very pervasive, very high level of informality in South Asia made these people, vulnerable to the shocks like the COVID, and the elevated levels of public debt and fiscal deficits have left little fiscal space for addressing such shocks. So this was the first message. The second message was about the socio-economic impacts, which, as you know, and all of us are passing through them. They have been very severe. The MSMEs, the micro, small, and medium enterprises, which form the backbone of each one of the South Asian countries, have been affected very badly because of these lockdown measures and other measures taken by the governments to contain the crisis. International trade has collapsed actually, and the export orders for South Asia, the export goods, including garments, are being cancelled. And that affects the producers and the workers working in those factories. Tourism has all but dried up, hitting not only Maldives, which is highly dependent upon tourism, but also affecting other countries like Sri Lanka, Nepal, other country also in the sub-region. Remittances, which form a very high and very important source of foreign exchange for every South Asian countries, but particularly for Nepal, are expected to decline by 22%. And in that context, I recently noted about the Bangladesh's new 2% cash incentive, which is actually leading to an increase in the remittances. Very interesting policy measure, I thought. And I hope other countries can also implement something like this. And as a result of all of these happening around us, the South Asian economies are likely to shrink. Uh, in this year, which is the first shrinking or downturn in the 40 years in South Asia. And the extent of downturn is becoming more and more severe with every passing day. Last week, the numbers of the quarterly GDP for estimates were released for India, which showed 24% downturn in one quarter, and that is a very bad news. So we are going to end this year in a very much reduced GDP than before. But much more importantly, for me, I think the loss of jobs and livelihoods that are likely to push as many as 132 million people in extreme poverty in South Asia, based on our some CG simulations, which were reported in this paper of ASCAP. The other thing is that the marginal and vulnerable groups, especially women, whether as health workers or garment factory workers, and the other vulnerable sections like migrant workers, slum dwellers, older persons, persons with disabilities, are at the forefront of this impact or incidence. And so inequalities are likely to widen. There have already been rising inequalities in South Asia, but they are going to get worse. Rising food insecurity could have long-term health consequences, especially for children who are not only missing their school, but along with the school, the midday meals. And for many children, those midday meals were the only nutritious meal they were getting. So these are the kind of consequences that South Asian countries are facing, especially the most populous ones, India, Pakistan, Bangladesh, and Nepal also, and Sri Lanka perhaps is slightly managing it better, along with Bhutan and Maldives. But everyone in a way is getting affected, and Afghanistan, of course, very badly affected as well. So the third message of this paper is about the national strategies to mitigate the crisis and impact. And we have said, we have made a very strong case for a large, very large, people-centered, inclusive and sustainable stimulus to meet this once in a lifetime, once in a century type of crisis. So there is no cost which is too big for meeting this. And then we went back to our model simulations and found that South Asian countries need between 7 to 14% of their GDP to be spent on these stimulus measures to contain and mitigate the damage and the lives and livelihoods that have been. And most important priority of this relief and stimulus package, of course, will be to save the lives by beefing up the public health infrastructure, which governments are doing everywhere, whichever they can do. But once you get over this, in the medium term, for bringing resilience to any future pandemics, we need to invest in healthcare, public healthcare, and invest in a universal health coverage, which is one of the SDG goals. The other is to save livelihoods, and for that, very big expansion of the public supports programs like EHSAS in Pakistan or Narega in India, the conditional cash transfers in Bangladesh, and every country has some such programs. So massive expansion of these programs, but in the medium term, again, to work on universal social protection to bring resilience to any future disasters. The other thing we have argued is that these programs, stimulus packages, could be combined very well with the sustainable and green projects such as waste to energy, micro hydro, home solar, so that you create some jobs and incomes and disposable purchasing power in the hands of people who work on these projects, but you also build a more sustainable and more decarbonized societies at the end of the tunnel. The other critical priority is to reignite the South Asia's growth engines, that is MSMEs, by immediate infusion of liquidity and funds into them. Again, governments are looking into this, and but I think much more needs to be done because the damage has been very, very serious. And we have also argued for a more decentralized system or pattern of urbanization, more decentralized, not condensed, in slums of Mumbai, Karachi, or Dhaka, but the much more decentralized one, which is less vulnerable to this kind of pandemics. Now, the other thing, while discussing these stimulus programs, we were talking about the challenges of financing such a ambitious program of stimulus. And of course, it's a very extraordinary time. And for meeting the challenge of these very extraordinary times, governments may like to put aside the fiscal prudence targets in the short term and come back to it in the medium term. But at this moment, I think bothering about fiscal prudence is not what one needs to do. And of course, we need to come back and have the fiscal prudence in medium term, but in the short term, do whatever it takes. That is the message we are giving. And for that, of course, we need a stronger international cooperation. We need, the international financial institutions to come to support the governments in all different countries, but South Asia, because it is much more severely impacted. And there are institutions like IMF, World Bank, ADB, AIIB, all lining up some, quick dispersal loans. But I think we need to look beyond these loans, whether creating a massive facility of new SDRs, to take care of the liquidity issues of South Asian countries could be an option. We need to look at new sources, of non-tax revenue. For instance, in the ministers' meeting that we organized in July, the Indian participant in that, Dr. Rajiv Kumar, the vice chairman of Niti Aayog, he talked about monetization of public assets, some assets which are underutilized, and monetize, get value from them to fund these stimulus packages. So something like this needs to be all considered. And so any resources, whatever we can get from wherever we can get, we need to mobilize them and, do whatever it takes. The final message of the report was about the criticality of South Asian cooperation, and whether it is in a bilateral manner or within the SARC framework, BIMSTEC framework, or ESCAP framework, any framework. It is immaterial, but we need to work together. And of course, leaders in this times have already realized that. And there was a summit, a virtual summit of SAARC leaders in March itself, which started to coordinate their actions. They created also a SAARC emergency response fund, COVID emergency response fund, and every single South Asian country contributed to it. So it was a very good, momentum generated from that summit. And I think we need to build on that momentum which was generated to harness the opportunities of South Asian cooperation, especially in the context of collapse of world trade. And if world trade is collapsing, whether we can harness the opportunities which are there in South Asia to exploit the potential of intra-regional trade, which remains largely unexploited, as our research shows that South Asia is only scratching the surface. We are exploiting only 1/3 of the potential of intra-regional trade, and whether we could create a new momentum, a new initiative to exploit the intra-regional trade in these difficult times when global trade is down. And the other thing we have talked is, the transport corridors. In this hour of crisis, we need to make sure that the supply chains and the corridors to ensure the supplies of medicines and food and all other essential commodities is not disrupted. So for that, we need to strengthen our transport corridors, and there are a number of initiatives that Bangladesh and India are taking in that respect, which can be expanded further to cover other South Asian countries. For instance, there is a new protocol of inland water transport in between India and Bangladesh. Very interesting initiative. So why we cannot extend such corridors to other countries in South Asia, which are linked by rivers, and the use of electronic tracking system to expedite the custom clearance procedure of these corridors could be an option. We have also argued for fast tracking of clean energy transition of South Asia in this challenging period, and cooperation in harnessing hydroelectricity potential, solar power potential, wind power potential. All of that could be very helpful and also will bring in greater sustainability and in longer term. Enhancing food security and climate resilience of agriculture of South Asia is another potential. And finally, the digital technology. In this moment of crisis, governments and people and companies have all turned to digital connectivity, digital technology for delivering services, whether it is telemedicine or direct benefit transfers. So it has underlined the criticality of the closing the digital divide. We need to really bring everybody connected with broadband, cables, and so this digital divide that still exists in South Asia needs to be really, closed. But also the important good practices that have surfaced in South Asia, for instance, contact tracing. Any COVID patient, is traced through these, one app. So those interesting good practices that we have innovated in this period should be shared. And so I think sharing of good practices is also going to be very important. And finally, the disaster proneness of South Asia is very much magnified in this period. Not only that we were facing the COVID crisis, but also at the same time there were cyclones, several cyclones hitting the sub-region. The flooding is a normal routine every year in this time, and all South Asian countries in different measures are affected by that. There was a locust attack on Pakistan, Afghanistan, India, and so there are many hazards, many crises, surfacing. So we need to build resilience by cooperation through early warning systems and sharing good practices. So, and some of these areas of cooperation are not new. They have been there for a long time, and some of the institutions, including ASCAP and SAARC and BIMSTEC, have been active in these. Now, I think we need to, in this context of COVID, we need to pursue them with much bigger, much more force and vigor, and we need to coordinate our actions and work together. So to conclude these messages coming out of this report, I think the COVID-19 represents a mammoth development challenge for South Asia and threatening to reverse hard-won development gains of a whole decade in poverty reduction, for instance. This extraordinary challenge requires an equally extraordinary response, but the objective should be not to go back to the status quo ante that prevailed before the onset of this crisis, but to build back better through large, inclusive and sustainable stimulus packages that decarbonize the economies while creating jobs and incomes, and move towards universal social protection and universal health coverage. And South Asian cooperation has the potential to complement national strategies for building back better. And UNESCAP, as a development partner of this sub-region, along with other such institutions, whether it is SAARC or BIMSTEC, we are happy to support this process. And this dialogue is part of that brainstorming how to do, how to manage this better. So with that, I really want to thank everyone for joining us, and I'm looking forward to some very interesting thoughts coming from you, especially focusing on regional cooperation opportunities in South Asian region, and that will be very much listened to attentively by all of us, and we will take this message forward to all our constituencies. With that, I stop here. Thank you. I want to, Rajan, please. Yeah.
Thank you, Dr. Nagesh Kumar, for your laying down the foundation for the talk, which we are expecting to look into the South Asian cooperation dynamics. May I now request Professor Akmal Hussain for his quick thoughts and to moderate the session. Professor Hussain.
Much, Rajan Ratna Sahib. Let me start by thanking Dr. Nagesh Kumar and Dr. Sachin Chaturvedi for bringing us all together, old friends, many of us, and I see in our gathering, our togetherness, a new hope for devising a path out of the depths of this crisis, devising a path that can change the destiny of the people of South Asia. I'll very briefly indicate 4 aspects of the vulnerability of South Asia that led to such a disastrous impact of the pandemic, when something like 132 million people have been pushed below the poverty line. Dr. Nagesh has covered some of these vulnerabilities, but I'd like to link them up if possible, in this very brief presentation. The first and obvious one is that we lacked in South Asia a health infrastructure which could provide universal health care to all citizens. As when we focus on this, we find how important it is to ensure the universal provision of health care. The second thing that the second vulnerability that exacerbated the adverse impact of the pandemic on the people of this region was the lack of a social security system which was universally available. By social security, I particularly mean unemployment benefits and state pensions. The third, I think, vulnerability, Nagesh, you will agree, although you didn't mention it, is that there was an absence of a financial cushion for those on the margins of poverty. And this cushion could have been provided and now can be provided in the future if South Asian countries declare a universal basic income for all citizens. That's the third vulnerability. You see that there was no cushion for the majority of the population when the lockdowns occurred and the unemployment increased. They were brought to starvation within a week, brought to a condition of starvation within a week of the lockdown. And that is why a large number of NGOs, including those in Pakistan, had to come to the fore and try to alleviate the suffering that the people were undergoing. I think the fourth dimension of this vulnerability is the acute economic inequality that prevails in South Asian countries. And this inequality has persisted and in fact has been exacerbated, has been accentuated precisely in those countries where growth rates were relatively high. We've got to therefore rethink our growth strategy in the future, and I'll very quickly, very briefly mention those things. So now, in getting out better from this crisis, clearly we South Asian countries have to declare the universal provision of healthcare and social security, and I would say also education. There are many, particularly those with a neoclassical way of thinking in multilateral agencies, who argue that poor countries cannot afford, developing countries cannot afford the universal provision of healthcare, education, and social protection. I would like to point out, on the basis of new data that has come out, which shows that those countries which made a commitment to the universal provision of these services that I've talked about, basic services, health, education, and social protection, at many of these countries at the time of giving the commitment had a per capita income that was lower than the per capita income of Pakistan or India today. Take the example of Germany under Bismarck, you find that when they gave this commitment, their per capita income was significantly lower than what it is in India or Pakistan. Similarly, if you look at China in Asia, in the middle of the 20th century, when they gave this commitment, their per capita income was much lower, substantially lower than that of India or Pakistan. And then if you look eastwards at Japan during the Meiji dynasty in the middle of the 19th century, you find that when Japan made this commitment for the universal provision of these three services, their per capita income was also lower than that of South Asian countries today. And so therefore, I think you cannot argue that we cannot afford to provide these services to our people because our per capita incomes are low. Indeed, one can argue that you cannot afford not to provide these services. And I think the pandemic and its impact has brought out rather dramatically the relevance and importance of this statement, that we cannot afford to not to provide these services, because the universal provision of these services lie at the heart of resilience against future pandemics and against future ecological disasters, the environmental disasters that are apparent right now. Okay, now the final point about inequality and how do we deal with that in coming out better, as Nagesh raised this point. You see, the point about inequality, there's been a major shift in development research and the results of development research in the last decade. If you remember, or as you know, in the old days, the idea was that inequality is good for growth. Because only the rich save, and when the rich become richer, the savings rate and the investment rate goes up, so inequality is good for growth. And Simon Kuznets presented his famous paper to show this, and he said that, over time the market system will gradually flatten the inequality curve, and then finally inequality will begin to decline so long as you continue to grow. Now, new evidence shows, particularly by Piketty, that in fact the Simon Kuznets view was a fairy story, and that in fact inequality globally has been persistently increasing as growth has been increasing. So that, you got to put that view aside, that inequality is good for growth and that over time it will be overcome through growth. The issue then is inequality good for growth or bad for growth? And the new research, particularly by people like Easterly and others from Harvard, has shown that indeed it is equality that is good for growth, not inequality. My research associate and I did an exercise where we looked at international data, a large number of countries, something like 120 countries, and discovered that those countries which had a more equal distribution of income were precisely the countries which had a higher rate of growth on a sustained basis. So now, what is the commonsensical basis of these research results? I mean, in what way is equality good for growth? And that is because creating equality means that you're tapping the productive potential of the excluded sections of society, hitherto excluded section, the middle classes and the poor. Now, if you educate the middle classes and the poor, give them high quality skills and education, and you give them access over investable resources, productive assets, you find that you have a much broader base of savings, investment, and productivity increase, and indeed of innovation if people are getting educated. And innovation is a major driver, as you know, of long-term economic growth. Professor Agion has established an empirical relationship where he shows that the greater the depth of and range of innovation, the higher the long-term growth is. And you can have a greater depth and a wider range of innovations if you involve the middle classes and the poor also into the process of innovation through education and healthcare. And so I think we in South Asia, in coming out better, could perhaps start thinking about restructuring our growth processes in such a way that we generate a higher and more sustained growth precisely through greater equality rather than inequality, which has happened in the last 7 decades. And effectively, this means that South Asian countries will have to invest much more in the development, in human development. They will have to invest much more in their own people, in their healthcare. Remember, healthcare and education and the provision of social services, social security, are not marginal or irrelevant to the growth process. They are central. They are a major factor in accelerating growth if you provide universal healthcare, education, and social protection. And this is quite apart from the fact that they build resilience in the economy against future pandemics and natural disasters like environmental disasters. I'll finally come to the question of regional cooperation. Now, clearly, as South Asian countries move towards addressing these vulnerabilities that Nagesh and I have just pointed out, the issue of universal healthcare, universal provision of social security, the universal basic income provision, reducing inequality. In moving towards these, what I think will be central is cooperation between the countries of South Asia. Cooperation not just in terms of sharing best practices, but also cooperation to accelerate trade and investment in the region. If you want the small and the micro, the small and medium scale enterprises to be the cutting edge of equitable growth in the future, then cooperation is absolutely essential, because cooperation will enable these small and medium-sized firms to get a regional market, to get regional access at the regional level over cheap industrial raw materials. And therefore, it will enable small firms to become medium-sized firms and medium-sized firms to become large-sized firms in the middle classes, amongst the middle classes and the poor. And so in that sense, I think regional cooperation could be a key element in our attempt to build a more equitable growth. Regional cooperation would also be essential if we want to invest in our people. We can together discover new and innovative methods, cost-effective methods of bringing universal healthcare and universal provision of education. You know, we can set up an integrated sort of communication system, a digitized communication system, where we provide the world-class knowledge on disease and epidemics and on disease control to people in the rural areas by setting up a kind of website for the region where this information could be accessed. Finally, regional cooperation is also necessary, I think, in terms of establishing regional supply chains for critical equipment in the medical field. You see, one of the things that we observed at the global level as a result of this pandemic, surprisingly, is that both the demand chain and the supply chain at the global level got disrupted. And so there were even developed countries were in a peculiar situation where, while they had luxury motor cars in showrooms that were locked up, and they had luxury jets waiting at airports, private jets, but there was a severe shortage of things like personal protective equipment, a severe shortage of medicines, of ventilators, which could be used to alleviate and deal with the COVID patients. So I think the reason for that was that the international supply chain for these things got disrupted. What we can do is that we set up a regional and integrated supply chain for these items for healthcare. And so that will be another element in building resilience in the case of future pandemics or indeed future natural disasters. One last thing about regional cooperation is about food security. I think Nagesh touched on this briefly. As you all know, one of the major predictions of the UN studies is that we may have a disastrous second disaster following the COVID-19, and that is the disaster of famine in many countries, because their food supply chain has been disrupted in many of the poor countries. And indeed, if we look at the future of South Asia over the next decade or 2 decades, we find that we're particularly vulnerable to the environmental, to climate change. You know, there's danger of sea levels rising and salinizing the low elevation coastal zones, where agriculture is being practiced. So you could have a large-scale movement of population from coastland to inland. You could have severe shortages of water. The heat effect, the increased temperatures could directly adversely affect yields per acre, as we have seen from the international studies done seen from the IPCC evidence. There could be as much as a 30% decline due to the heat effect alone in the yields per acre of grains. So what we're talking about as a result of the environmental crisis is that to which South Asia is particularly vulnerable. We are actually looking at major food shortages and famines in this region. And therefore, I think this is acquiring food security and setting up a supply system where food in surplus from surplus districts can be moved to food in deficit areas. That cooperation is absolutely vital if we are to reduce our vulnerability to famines in the years ahead. So I just close there with the simple statement that when a region such as South Asia and its communities are faced with a common threat of pandemics, of environmental disasters, then we improve the chances of survival through cooperation rather than through conflict. That is the way human communities have managed to survive over the ages. You know, whenever they were faced with an exogenous threat, they cooperated and came together. And I think we must learn from history and come together, as both Nagesh and I have suggested, come together to come out of the COVID-19 crisis better. We can't just return to the status quo ante. You know, we've got to restructure our economies so that we have a more equitable growth. We've got to redesign the infrastructure for health, education, and social protection so that we make it available to all of the people. And I think the most important thing, which very few people have focused on, and this is one of the lessons that has come out from this terrible impact, which Nagesh has pointed out, is that we don't have we need to have a universal basic income for all, so that people don't go into starvation as soon as a lockdown occurs or some disaster occurs. I'll end there and let's just mention, just take a minute to say before we ask the speakers to speak, is that we're very fortunate that we've got a real galaxy of stars here in the panel. They're the brightest stars, amongst the brightest stars on the South Asian horizon today, intellectually. And I'm looking forward to an intellectual treat when I hear each one of you speak. What I suggest is that, each one of you is absolutely brilliant. I've just been looking at the names. There's Mr. Nazir Kabiri from Afghanistan. There's Dr. Fahmida Khatoon from the CPD Bangladesh. Professor Sachin Chaturvedi, the Director General of RIS, brilliant gentleman whom I know. Mr. Aishat Saad, of the government of Maldives, Dr. Posh Raj Pandey, whom we just saw on the screen. Dr. Abid Suleri is one of our brightest young economists and policymakers, and he's making a major contribution to providing a new perspective on policy. And he's been in the forefront, frankly, of fighting the pandemic. And then we got Dr. Dushni Verakun from the Institute of Policy Studies at Sri Lanka. And then finally, Mr. Wangchuk Namge from the, he's the Chief Development Cooperation Division of the famous GNHC in Bhutan. So with this stellar group of speakers, I request now, let me start in the order that I've been given, Mr. Nazir Kabiri. And please restrict yourselves to 7 minutes, if possible. We'll appreciate that. so that we have some time at the end for a general discussion. So, Mr. Nazir Kabiri, the floor is yours, sir.
Thank you very much, Professor Hussain, for the kind introduction. And I also wanted to take this opportunity to thank Dr. Nagesh and Dr. Ratna, rest of our counterpart, the executive directors from the leading and respected think tanks in South Asia. Dear audience, ladies and gentlemen, it's a pleasure being amongst you here this afternoon. Provided of the time that's allocated to my presentation, I will be using a few slides from my desktop that would hopefully help us to put the things into the perspective. Is the screen visible now, Rakesh?
Sorry?
Sir, you are now presenter. You can present your screen.
Sure. Can you see the presentation at the moment? I'm trying to share my screen. Can you see the screen?
I'm afraid not.
Okay, let me try again. I have to be clicking this, and now I guess it must have been on the screen. Can you see this? Is that viewed? Is it viewed? Mr. Rakesh?
Sir, can you please pass on this PPT to me immediately?
Okay. This must be on the screen at the moment, but I guess for some technical reasons. But I will start anyway before I could run the presentation. In terms of the context for Afghanistan, this year has been a little too challenging, provided we had contested presidential elections followed by the pandemic, making things a little too complicated. Secondly, in terms of on the health front, the official report indicates of cases of around 40,000 infections in the country, but a survey done by the Ministry of Public Health indicates that around 10 million people, almost 1/3 of the population, were likely infected and recovered from COVID-19. But again, with the political impasse ended, and now the uncertainty involving the peace process, making things a little complicated. Second, the third, in terms of the context, is the recent surges in conflict and violence in a number of provinces across the country. With this context, if I move towards the economic indicators, first, in terms of the growth rate, the Afghan economy has fallen into a strong recession in 2020. And this means that the World Bank projects a contraction of 7.5%. But our estimations and projections at the Biruni Institute suggest a contraction of 8.2%. With this, certainly, trade has declined in the second quarter of 2020 to an historically low levels. Exports dropped to merely 32 million in the second quarter of 2020 compared to 150 million in the second quarter of 2019. This is an historically low level of quarterly export ever recorded in the last 2 decades. The same way, in terms of the imports too dropped to an unprecedented low level. This second quarter, we record an import level amounting 1 billion compared to 1.6 billion in the second quarter of the last year, 2019. This also reflects a weakening domestic demand.
Similarly, Nazir Saab, I'm sorry to intervene. Can you switch on your camera? Because on the YouTube, we are streaming live and it is coming blank. Yeah, so you
Sure.
keep your camera on, please, because it's parallelly showing on YouTube, so it was showing blank. Thank you.
Okay.
Please continue. Sorry.
I also did share the presentation with Rakesh, and I hope that can be displayed on the screen if possible. Similarly, in terms of the impacts on the formal businesses, and this being the slide number 3, if Rakesh could help us put that on the screen, we note, based on a survey by the World Bank, and also conducted by the World Bank IFC, it suggests that during the months of June and July, only 37% of the businesses were open. This means that the rest were either permanently or temporarily closed. This also suggests that a widespread decline in the sales, over half of the businesses accumulated areas. Similarly, 23% of employees have lost their jobs. With this, significant increase in use of digital platforms are being noticed by the businesses. Moving on the fiscal and revenue side, really quickly, with economic contraction of 8.2%, domestic revenues have sharply declined. This suggests that the projected decline could be around 30% by the end of 2020. Similarly, this shortfall will open a fiscal gap of an unfinanced fiscal gap of a deficit of around $525 million for the government, which could be challenging end of this year to possibly pay the salaries of the civil servants. I turn into another important and major indicator for all of us in this region, and that's being poverty. Poverty and underemployment are projected to sharply increase by the end of 2020. A World Bank estimation forecast suggests an increase from 54% poverty rate in 2015 to a sharp increase of 72% poverty rate by the end of 2020. In a more realistic estimation by the Biruni Institute, a poverty rate of 80% is being estimated. This means that around 8 million additional people in Afghanistan would fall below the poverty line, increasing the total number of poor to 25 million out of 33 million population, which is extremely unfortunate. In terms of the unemployment and underemployment, is forecasted to increase from 39% in 2017 to 53.5% by the end of 2020. Similarly, for the employment, this means that nearly 4.8 million people will be either unemployed or underemployed by the end of 2020, an increase of 1.5 million people compared to 2017 numbers. On a final slide, in terms of building back better, as per the suggestion of the organizers and with a view of the regional cooperation, our understanding is as following. Number one, the nature of the Afghan economy is so different than the rest of us in South Asia. This means that Afghanistan remains heavily reliant on the international aid. At the moment, as we speak, international grants in Afghanistan pay for 75% of public expenditure, that both on budget and off budget. If you move to the very last slide, or maybe really quickly put on display a few of the slides that I have discussed, Rakesh, maybe you can jump to the very last slide. With this, we emphasize on the importance of bilateral trade. Trade during the pandemic with our neighbors, especially with Pakistan and Iran, showed how important this could be and how the supply and change could be vital for the food security as well as for the businesses, provided that we still heavily rely on Pakistan for trade in transit. On this suggestion for trade, one observation is that Afghanistan still does not have a trade agreement with our neighboring Pakistan, while we do still have a transit trade agreement with Pakistan. A suggestion is to possibly for both countries to look into a bilateral trade agreement. In terms of the wider region, for regional cooperation, the chances that possibly the COVID-19 pandemic could unlock the full potential of regional cooperation in terms of the overland trade that remains extremely low based on the political complications in the region. COVID-19 will not encourage will encourage nationalism instead of regionalism, as we just see the current trend. It will further encourage inward nationalistic policies. COVID-19 is not going to change any geopolitical fault lines in South Asia. Moving forward on a very last point.
Mr. Kabiri, may I request you to please wind up as within the next couple of minutes?
This is my very last point in terms of the future and predictability of aid. As I suggested, that this country remains heavily reliant on international aid. With the peace being in horizon, post-peace economic development remains vital. And as the government and international community is preparing for a talk in Doha, similarly, an economic conference is being scheduled for Afghanistan this November in Geneva. And that pledging conference will be extremely vital for a country which is heavily reliant on aid. So with that, we look forward to a discussion post-peace where the economic recovery of post-peace will be very important. Thank you, sir. Over to you.
So the kinds of regional cooperation we could undertake. May I now request Dr. Hamida Khatun, Executive Center for Policy Dialogue in Bangladesh, to please speak for 7 minutes.
Thank you very much. I would like to thank Dr. Nagesh Kumar and Dr. Sachin Chaturvedi for taking this initiative. Very timely initiative indeed. And thank you, Dr. Akmal, for inviting me. And I think my talk will be very short because in the beginning, what Dr. Nagesh had laid out, in fact, covers all the aspects, all the important aspects which the South Asian countries are dealing with at the moment. He had rightly pointed out from the report which had been published few days back. So there, the challenges, the weaknesses which have been exposed during this COVID period in this region, those have been mentioned, and where are the challenges and how to now build back better. And then Professor Akmal Hussain very lucidly and very eloquently discussed the major issues while we build back to look at the some of the important issues, including the quality of growth, the inequality issues, and all these. So I will very quickly highlight some of the issues, not so much what is happening in Bangladesh, but rather, since the idea of this dialogue is to how to build back better in a regional framework, and how South Asian cooperation can help countries to recover better. So my focus will be on that, but let me just give a very brief introduction that what is happening on the ground in Bangladesh. Like all the other South Asian countries, you know that Bangladesh has also an increasing rate of cases. But if you compare with the other South Asian countries, Bangladesh has the third highest number of cases per million in South Asia after Maldives and India. But the number of tests and the number of cases, there are differences. For example, in Bangladesh, I think Bangladesh has the lowest number of tests per 1,000 in South Asia. It's only 9. And in case of the highest positive rates, also Bangladesh, as of 1st September, the data shows that there was 1 positive COVID case for every 5.8 tests. Compare this number with 1 positive COVID case per 8.96 for Maldives, 12.32 for Nepal, and 12.76 for India, 63.30 for Pakistan. So we see that in case of both the cases and also in case of the test, we have some limitations. Now, the other important aspect I just want to highlight, maybe not so important, but it's some sort of peculiar in the sense that for the tests we are still way behind, but and there is also that not many people are doing the test. But from June 30th, the tests for the patients or any citizen in the government hospitals, that has been made charged. So if anyone goes, the person has to pay a fee in government hospital, which is, I think, as far as my knowledge goes, Bangladesh is the only country in South Asia where a fee is charged for testing COVID at government healthcare system. Correct me if I am wrong, but this is not, though of course government hospitals are heavily subsidized, but we thought that this for this particular case, the test should have been free of charge, because in government hospitals usually the people with limited income and the poor people, they go. Now since COVID is a health crisis, and we look at the COVID health situation at the beginning, and rightly so. And we see that in terms of the health infrastructure, which has been mentioned earlier also, that the health infrastructure is also very poor and inadequate, particularly to deal with the COVID-19 situation. In normal cases also, for example, there is only one hospital bed per 1,196 persons. So in a normal situation, this health infrastructure struggles a lot to take care of the patients. Now with COVID, this has become even more difficult. And this goes for, if you take the statistics for registered physician, for example, there are one registered physician for every 1,581 persons. So this also shows the dearth of hospital facilities. Now, coming to the economic and social fallout of COVID-19, which is not different, which my previous speaker, Dr. Nazir Kibri, he has mentioned about the economic slowdown and various indicators which are not performing well. In case of Bangladesh also, statistics from various international organizations like the World Bank, IMF, then Economic Intelligence Unit, they have come up with growth numbers. In fact, as you know, that Bangladesh has been one of the very fastest growing economy in the region. And this year it had been projected that the economy will grow at 8.2%. But all these organizations had predicted that the growth will not be, will range from 2 to 3% or 4%. And from our Center for Policy Dialogue, we also estimated, which is again 2.5%, but it might change also with the data coming in. But the reason for saying that the estimated or the projected growth is not going to be achieved. Meanwhile, the government has also come up with a number which is higher than the other estimates, that is 5.2%, whereas, as I mentioned, that World Bank had estimated it would be 1.6%, IMF said it would be 3.8%, EIU estimated that it would be 1.6%. So whatever the numbers, the GDP growth is going to have an impact, definitely. And also, meanwhile, the structure of the economy, there'll be a transformation in the structure of the economy, in the sense that the employment structure within the economy will be different, because as we were moving, the industry and service sectors, those were leading in terms of job creation. But with COVID coming in, agriculture had again become a dominant sector. Many people are going back to villages and they are getting involved either in farm and non-farm activities. So rural economy will play an important role during this period. Now, jobs have been, various estimates have shown that there are less jobs available. Unemployment situation has deteriorated, and particularly during the holiday, in fact, that was the general lockdown. in Bangladesh it was to call holidays for 2 months, and during that period, as high as 71% of the people had become jobless, and as a result, income had dropped and inequality had also increased. As we know that even though Bangladesh was growing at a very fast and high rate, but we were not being able to reduce inequality, both in terms of consumption inequality, income inequality, and even wealth inequality. So in all three aspects, we are not doing as good as we are doing in terms of GDP growth rate. Now this, with COVID coming in, this vulnerable groups will become more vulnerable, and people who were just above the threshold of poverty level, they have fallen into poverty rate. And in case of other indicators, export and trade and investment, those are other important indicators of the economy, and we see a sharp fall both in exports and imports because exports, Bangladesh depends on the ready-made garment sectors, and because of the low demand from the Western countries and European countries, and also the North American countries, there is a sharp decline. And in the beginning, many buyers had also cancelled orders. Now, with the economy just started to open up across the world, the orders have started to come, but not as as much as we had. It will take some time. And in case of imports, we also see a sharp decline because there is no investment. So that again, the environment, the whole investment environment will take some time to revive. As it is, even during normal time, one of the weak links of the Bangladesh economy was that private investment was not picking up, and it was hovering around 23% of GDP. But for a growing economy, it has to cross, it has to go beyond 30%. So now with COVID coming, yeah, I will just I'll just quickly. I will go quickly. What is the theme of this dialogue? The regional cooperation or South Asian cooperation to build back better. So I will focus on 2-3 issues. One is that I think that sustainable development goals can be a major framework for collaboration, cooperation, and to build back better. In the beginning, Dr. Nagesh was mentioning regarding green recovery. This is one of the important areas. In fact, last year, Jeffrey Sachs had written about the SDGs, and he mentioned that if we focus on 6 SDGs, that will actually take care of the other SDGs also. These are the most important ones, where we can also think in South Asia, we can think of improving upon together with the other countries. One is education, gender inequality, then health, well-being, demography, energy decarbonization, and sustainable industry, then sustainable food, land, water, oceans, sustainable cities and communities, and finally the digital revolution for sustainable development. So these are important. But 2 more points I would like to highlight for regional cooperation is very, very important, since the COVID is a health crisis, first of all, and we have seen the weaknesses in the health system, the malgovernance, lack of governance, mismanagement, all these issues have come up. In fact, during crisis period, the weaknesses become more prominent, more visible, and COVID has just done that. I feel that in case of healthcare, there is a vast opportunity. There is huge opportunity for cooperation, and particularly we see that Dr. Nagesh has mentioned about the SARS-CoV emergency fund, and we have seen also Bangladesh has sent emergency medicines to Bhutan, as well as aid and doctors to Maldives to assist these countries, and even the other countries are also supporting. India has sent testing kits and humanitarian aid to Bangladesh, and now that the vaccine invention is on the way, I feel that some of the in case of Bangladesh, some of the pharmaceutical companies and India, they have already reached some arrangement regarding accessibility or availability of vaccines. So in case of vaccines, I think neighbor first policy should be followed so that the neighboring countries get the vaccine at an affordable price first. And then in case of education, that's another important issue, I think, where regional cooperation can help a lot. During COVID, we are observing that the use of technology has increased across all sectors. And in case of education also, or the online education has become a way out. But, in case of Bangladesh and many countries of South Asia, I think only a handful of students can have this opportunity. They don't have any access to internet, access to smartphone or laptop. So technological access is one thing, and also the curriculum. Even those who have access, the teachers, school teachers and college teachers who are giving lessons to students online. I think there is we find every day that in the media that they don't know we don't have experience of developing online curriculum, how to make classes more attractive, more interactive, more productive. That has become a very difficult situation and problematic issue. The content development for online education is very, very important. And also, in order to bring or keep the students in the education, this is very important, because already we know that in case of Bangladesh, the poor students, those who are out of schools for the last couple of months, the parents are sending the boys for work to earn their livelihoods, and parents are marrying their daughters off at a very young age. So which not only risks the girls but also future generation, because these are young girls who will become mothers, and the achievements which have been done by Bangladesh in case of reduction of maternal mortality, reduction of child mortality, those achievements will be reversed now. So we will really have to look into these issues, and regionally, I'm sure some of the other South Asian countries also have similar features. So we'll have to also collaborate and cooperate. I think I would end here. There are other issues, but those have been aptly covered by Nagesh, and I fully endorse those. Thank you very much.
Okay. So may I now request Mr. Wangchuk Namge, Chief Development Corporation Division, the GNHC in Bhutan, please. Can you hear me, Mr. Wangchuk Namge?
Please unmute yourself.
Okay. Can you hear me?
Yes, we can hear you now.
Thank you, Escape, for coordinating this meeting and taking initiative in getting all the South Asian member countries to one forum and share our perspectives in terms of how we have been doing and what are the recovery plans that we have in terms of building back better. Now, in my case, mostly my presentation would be, again, of course, definitely it would be confined within 7 minutes time, but would mostly focus on Bhutan and in terms of recovery plan that Bhutan had initiated, other regional cooperation. So just to start with, I'll give overall background, a bit of the issue that we have in Bhutan. Now, overall, due to the pandemic, Bhutan's GDP growth is forecasted to dip as low as -6.7 at the end of 2020 from 1% at the beginning of 2020. The country for this year will also witness an all-time high resource gap or fiscal deficit of around 15 billion, which is 7.6% of the GDP. As elsewhere, almost all sectors in Bhutan have been impacted by COVID-19. However, the impacts in Bhutan on import like tourism, construction, and manufacturing sector, as the previous spoke on quotation small industries and SMEs, So here, even Bhutan also, these are one of the sectors that is devastated, in fact, by the COVID. So in the interest of time, my discussion today will mostly focus on these three sectors, that is tourism, manufacturing, manufacturing and construction, in terms of its impact and economic recovery plan. Now, let me begin with the impacts on tourism sector. The tourism sector is one of the main sectors that generate convertible currency for the country. As a consequence of COVID-19, the sector was completely suspended since March 2020. This has resulted into the loss of livelihood of people who depended on tourism and a sharp decline in revenue for the country by 41% in 2020 compared to the previous year. Like tourism sector, the construction sector was also hard hit by the COVID-19. The sector's share to GDP is 14% in 2018. The sector is fully dependent on Indian foreign workers. Due to the COVID-19 and travel restrictions, both in Bhutan and India, the foreign workers' entry to Bhutan was restricted, resulting in workforce shortage in Bhutan, which stands at 14,495 people. Of course, this figure may be very small to rest of the South Asian country here, but for a country like Bhutan with few population, these figures are very high. This sector has also the highest credit exposure of rupees 37 billion, 27% of the total credit in 2019. Therefore, any mismanagement or lack of attention to this sector will have an unprecedented consequences to the country's economy, especially in terms of non-performing loans and stalling both ongoing and new construction activities. On the manufacturing and mining sector, it is seen as a critical sector in terms of convertible currency, generating employment and bridging the widening trade deficit. In 2018, this sector constituted 38% of the total revenue and 75% of the total export. Like the construction sector, this sector is also heavily reliant on India for both raw material and the market. Therefore, lockdown and travel restriction in India is bound to have impact on this sector. Let me now move over to the recovery plans that we have initiated to rebuild ourselves. These recovery plans in these presentations are categorized into two. One, cross-cutting recovery plans applicable to the entire country, and B, sector-specific recovery plan specific to the above discussed three sectors of tourism, manufacturing, and construction. Now let me touch on the cross-cutting recovery plan. For an imminent respite and relief, His Majesty the King had instituted a Drukgyalpo Relief Fund, is basically a social safety network fund. Through this fund, His Majesty had granted Indian rupee 1 billion to over 40,000 needy people, covering mostly laid off and children. Likewise, to ensure the continuity of economic activities, especially the struggling business, the government had provided a loan deferral and interest waiver of rupees 9.3 billion. And again, these loans are to the SMEs and small and cottage industries that are struggling because of COVID-19. Another cross-cutting recovery plan is revisiting the current 12 5-year plan. We have a 5-year plan system, which the current 12 5-year plan started from 2018 and it will end in 2023. So the plan had objective and plan had so many activities within the plan. Now, because of the change in situation, we are thinking to revisit the plan and look the plan through the lens of current pandemic and economic recovery. And the government would also fast track some of the major plan activities that would have potential implication or that would have potentials to reboot the economy and generate employment opportunities. On the sector-specific plan, now let me go to the sector-specific recovery plan. The government had initiated economic contingency plan focusing on tourism, construction, and agriculture sector. As I said, these are the sectors that are impacted the most. So under this plan, government would spend Indian rupees 4.5 billion aimed to build back tourism sector better through skilling and reskilling of people engaged in tourism sector, diversifying tourism products and refurbishing the tourism facilities so that they become readily available and maintained when the sector is open for business. Given the travel restriction for international tourists, domestic tourism is also explored, especially pilgrimage and visiting cultural and historical sites. For the recovery plan of the construction sector and addressing the above discussed issue of labor shortages in the construction sector, the government had launched a project called Build Bhutan Project. Under this project, in the absence of Indian foreign workers, the project is meeting the workforce gap with the domestic labor that constitute unemployed people, laid off employees, employees on unpaid leave, and overseas returnees. In fact, these are the victims of the COVID-19. So these domestic workforces are provided incentives by the government, again in the form of social safety networks, pensions, wage top-ups, and are directly engaged with the employer if they are skilled. In the case of unskilled, the government provides skilling and upskilling so that they become employable. The project is initially aiming to engage around 7,000 skilled workers, meaning that and again, around 14,000 workers will be trained, reskilled, and make them employable. Finally, let me now move down to the recovery plan for manufacturing sector. Given the importance of this sector, the government had started the preparation of Economic Contingency Plan Series 2, focusing on how to build this sector better through provisioning of enabling environment, access to finance, raw materials, access to market, and other enabling facilities. This plan will also explore sustainably harvesting of Bhutan's forests to meet the domestic demand and for generation of convertible currency, which is all-time low because of tourism sector standstill. Currently, the forest and log Bhutan is with a negative growth of 1% since 2016, despite the fact that 70% of Bhutan forests. Bhutan harvest only 3.7% of net annual increment of forest, which is 0.05% of the growing stock, leaving a vast potential of timber untouched and overstocked. Therefore, this sector would provide us with a huge potential and solace to build ourselves better, wiser, and stronger than before. Now, finally, let me touch on the regional cooperation. Now, in terms of regional cooperation and other multilateral and bilateral cooperation, Bhutan is fortunate to receive quite a lot of support from bilateral countries like India and Bangladesh in terms of both cash as well as kind. And also Bhutan is also grateful to other financial institutions like World Bank, ADB. So much of fund have been put into Bhutan in terms of fighting COVID and building the country better. So with this, I think I'll end my presentation here, and maybe should there be questions, I can answer them later. Thank you, sir. Over to you.
May I thank you very much, Dr. Virakun. Are you finished with your talk? Yeah. Okay. So may I now request Professor Sachin Chaturvedi, Director General RIS India, to please speak for 7 minutes, if possible.
Thank you. Thanks a lot, Professor Akmal, for giving this opportunity. I join you on behalf of SASEPS to thank Dr. Nagesh and UNESCAP for connecting with SASEPS and giving SASEPS this opportunity of partnering with the UNESCAP in South Asia, for bringing all our key think tanks and, as you said, the leading thinkers and practitioners from South Asia together, from RIS and from SASEPS. I'm extremely thankful to them for continuing our collective partnership at SASEPS. And I think all of us are missing Professor Deepak Nayyar today, but I am sure he would be too happy to see the way this process is going. I would have a few slides to share as I move forward, and I would promise you to honor the time constraints that all of us have today. And I would really try to finish my presentation in the time that you have very kindly allotted to me. I would also request, I think, our team, Mr. Raman, to give me the opportunity of sharing my screen so that I can put my PowerPoint up here.
You are promoted now.
Sachin, you can use the share screen.
Sachin, please use the share screen.
I think there is.
Or if you would like, I can present your PPT.
Yeah, I think you can bring on the screen because this is somehow going off with my camera. So, the point, Professor Akmal, I have just brought 3 points, and I would quickly get into my PowerPoint. The 3 points that I want to make. One is in terms of the unprecedented financial and economic crisis that Indian economy is facing after the COVID-19. That's my first point. The second point I want to make is that even in this, and when we are talking about regional cooperation, the financial sector cooperation is extremely well placed, and the central banks are providing us an opportunity to see how quietly and substantively they are working together. And third point is the other areas which Dr. Nagesh have captured very well. So under these 3 broad points, I would make my presentation in next 3-4 minutes, and I would be very quick. The large impact, can we go on the next slide, please? So the large impact that we are seeing is in terms of, the first point. Is the next after this. So the first point that I want to make is in terms of the areas that are sort of coming out in terms of the shrinkage that we see in Indian GDP, where it has not only come down in a major way, almost a 13% blow to it, and we find that if we navigate the output gap, it is estimated to be somewhere close to minus 12%, and the services sector, the merchandise exports, as Dr. Nagesh very rightly said, trade has almost collapsed, and this we are witnessing here in India. Consumption and investment, the sort of implications are extremely troublesome. Employment is another major area, and it is not just COVID-19. Even what we inherited in the year was also showing huge shrinkage in the formal sector, and that I think is an important dimension of this. The reverse migration that happened from the urban areas, where almost 51% of the informal sector, that has also, in a way, adversely affected the process where we were expecting some of the changes that are there. Next slide, please. So the larger question is, at what prospect we can stand when we think of V, U, or L-shaped recovery. The efforts in terms of indigenizing the production structure, reducing the huge sort of lost out opportunities on job creation, and bringing in the idea of a domestic production in a major way through the Atmanirbhar Bharat schemes and other such fiscal stimulus to not only generate demand but also have supply side sort of constraints duly addressed, and that I think would be extremely important. Next slide. If we look at the gaps that are coming up in terms of the issues on on finance, the Reserve Bank of India has tried through its best in terms of putting the LTRO, the long-term repo operations, which were introduced in February 2020 for durable liquidity crisis, because that was another major issue we were tackling for a couple of months before COVID set in, and that actually gave a major blow. So for 1 to 3 years, LTRO, they were introduced, and then they had to be targeted, and the TLTRO came up in March 2020 for another 3 years, and then TLTRO 2.0, exclusively focusing on the NBFC crisis. The special efforts were made to sort of bring in liquidity through recapitalization of NABARD, SIDBI, and the National Housing Bank, and they gave the necessary support to the system. The recovery point, as I said, is absolutely clear in terms of how we are going to go forward on the dimensions and points that are to be addressed. Next slide. We are also seeing the SARC Finance doing some extremely wonderful work with Reserve Bank of India, taking over the chairmanship in 2019. The currency swap framework for $2 billion that were sort of agreed upon. The RBI has already signed agreement with Sri Lankan Central Bank for $400 million. Bhutan and Sri Lanka have also, Maldives have also signed agreement. So this has come up in a major way. Next slide. We also see the points coming up through roadmap on capacity building, and also trying to see that the SARC Finance set up the international connect that at this point India has through India's connect with G20. So the Reserve Bank is part of the framework working group, and also India would be hosting the BRICS summit next year. So next year the BRICS, and in the following year the G20. These dimensions also provide finance a major opportunity to connect. Next slide, please. We are trying to see. Next slide. We are trying to see what kind of dimensions here itself are possible, and there the connect comes in through the SF Sync and SF scholarships. These SARC Finance Sync that is trying to bring in the secure channel for intra-SARC central bank communication, and the fellowships that have come up, and these are providing the sort of opportunities for various scholars from other central banks to come and spend time and absorb the gravitas of the finance management and the wherewithals that are needed for regional cooperation. And I think in the post-COVID time, this is one very important sector on which, fortunately, the central banks have continued to cooperate. Next slide. Next slide. Yeah, this is, the previous one. Yeah, this is an important area in which joint studies have been initiated by the central banks. One is on the fintech and financial inclusion. And I think post-COVID scenario in South Asia as a whole has contributed hugely in terms of exclusions that have happened. And that I think is extremely important for the central banks and, of course, the governments to come together to see how financial technology can provide support for regional cooperation, and bringing together as early as February 2020, they had a sort of a focus on fintech, which was just at the onset of the COVID crisis. And this, I think, if deepened further down the year, would be extremely important. India and ASEAN countries are already linked on fintech page. So South Asia as a whole, if it gets connected with India's efforts, the traction and the spillover effects in the region for financial inclusion and bringing in fintech for our regional financial solutions, I think would be extremely important. And global connect of India's these initiatives can then be leveraged by all the members of the South Asian community for our collective gains, because India is already connected with that. Next slide. Yeah, this is the last one. So here I'm trying to say, and this is my third and the last point, where I'm trying to say that apart from financial sector, we also need to see regional cooperation going in with only 1.28, depends on how you calculate India's GDP expenditure on health, 1.28 to 1.57% of GDP through different calculations. And the health minister is on record that in next 5 years, our target would be to bring in to almost 6% of India's GDP. And that requires collective efforts by states and the central government. Yes, you can stop sharing the PowerPoint now, please. So that I think is important. As Dr. Famida very rightly said, we need to focus on the vaccine distribution, and this is an important dimension as we are moving forward with our collective cooperation, trying to see that we share the vaccine as soon as it comes out. India is already expecting that down the year. The phase 3 trials are almost done, and I'm sure it would be available with neighborhood first policy. Thank you.
Wonderful, Sachin, excellent. Well done, thank you.
Thank you,
okay,
thank you.
Now, may I request Mr. Aishat Saad, the SDG focal point, Government of the Maldives, to please speak for 7 minutes.
Thank you, sir. Honorable panelists, ladies and gentlemen, Assalamu alaikum. I thank the UNESCAP for creating such platforms, which is very much we are in need at the moment, and it is my privilege to be part of it. As we all realize now that COVID-19 is no more a health crisis, but a social and economic plague that has affected our every way of life and added onto all the significant burdens that we are sharing at the moment. And in our effort to combat the pandemic, Maldives has managed to confine the COVID-19 to the epicenter, Male, the capital. Interagency coordination and timely measures taken and capacity building and to create awareness, efforts to create awareness has provided has prevented the disease from spreading to the other parts of the country and burdening the health systems. But when we talk about Male, it is, though we are saying it's a capital, it is where like 2/3 of the country are already residing. So it's quite a big number. IMF estimates that Maldives is one of the hardest hit economies in the region, and our GDP has contracted by 13%, and our fiscal deficit increased by 14.5%. Relative as borders closed down and lockdowns became the new norm, the country's two major industries, tourism and construction, collapsed overnight. And redundancy in livelihood lost was most among the youth, women, and expatriate laborers we have in the country. The government, to mitigate the burden, the government brought in rapid series of measures to soften the blow onto the public. And to this effect, we have committed about 2.5% of the GDP to help business enterprises, and measures of loan memorandums has been extended for 6 months, that is including housing loans and student loans. and further schemes to provide monthly income support to individuals who lost their jobs, including freelancers, was introduced by the government as well. Minimum reserve requirement ratio was reduced from 10% to 7.5 to provide liquidity to the financial system. Also, the government subsidized utility bills across the country and controlled price of essentials. The government in this manner focused mitigation efforts to reduce the social and economic impacts via human-centric measures. Government bodies were able to quickly move a lot of the government businesses to the online platforms, thanks to the efforts that were already in the pipeline towards a digital government. Online platforms were set up and forced and running, including teleclasses for schools, telemedicine, and also ensured continuity of essential services and for entertainment purposes as well. Even in the private sector adopted this without the delay, and businesses online working from home became the new norm. Nevertheless, with the limited access to technological advancements, we cannot deny the digital divide do exist among our people. Fear that the people may face the risk of sliding into poverty with efforts of the pandemic cannot be ignored. Reduced access to services during the lockdown affected vulnerable groups whose access were already constrained due to the geographic conditions of our island nation. Issues such as mental health and non-COVID related diseases, violence against women, and sexual exploitation and abuse were reported. Service for provision and response being under pressure, increased burden on women due to the increased domestic care and the severely economically affected groups. Both youth and women remain to be issues which we need to carefully consider. The new mitigation and recovery efforts were also generally complied by the existing social protection networks we already had, and universal healthcare coverage being part of it played a great role in accessing everyone to healthcare and testing. So we are one of the few countries that who already have universal access to healthcare. So this played a really crucial role in reaching everyone in this time of need. When the pandemic hit us, vulnerable individuals and already been identified through many of the social protection schemes that we were already having. And however, there were issues of reaching out due to logistical reasons and better coordination, and building on it, we will need to work on it in future. And also, we cannot ignore the new emergence of the new poor, which needs to be strategically woven into our systems. The new normal calls for interventions that are targeted towards the most vulnerable and marginalized. We are committed to build back better our economy and our society. Lessons learned from this episode are many in life. Building back better needs to ensure inclusivity and sustainability woven into the planning in the plans of the future. The pandemic also reminded us how much the world's environment needed healing and the need to be gentle on the planet. Accelerating economic recovery for Maldives is revamping the tourism industry with a focus of safe tourism, and opening our borders for tourism near and far. Increasing the participation of SMEs in the economy and escalating productivity is one of the focus areas, and getting the labor force retrained into new areas is also one of the key areas that the government is focusing on. And continuity of education is also crucial, and we are very fortunate to have done some work in having existing platforms or working towards digital schooling before the pandemic had arrived. So last year we had tablets distributed to nearly all the children in the public schooling systems, and about 95% of our students are from public schools. So it was easy for the government to address this issue because the disparities would be small, and it is within the government portfolio to manage these schools as well. So as Dr. Nagesh mentioned earlier on, it is important that we invest in this education and health if we want to be progressing. And Maldives has been doing it for about 40 years already, free education and free healthcare for all. And today we are bearing the fruits of the investments that we were actually which we actually made. So the use of technology during the pandemic was such an insight gained by everyone, and internet affordability and strong ICT infrastructure is essential, and we really need to work on that area as well to reduce the parity in the digital divide. Being a population of young people, adaptability was not that difficult for many of the people moving trade or economic services, or we were already practicing, especially in the higher education sectors, digital platforms to convey or spread education. So it was not that difficult to move into these platforms in our experience. But still, we really have to keep in mind that there are people who are not totally digital savvy, or because of the high price of internet, it is not very feasible for them. So we need to work on these areas as well. Also, heavy dependence on regional and sub-regional cooperation we see is very vital to overcome the effects of the pandemic. Collaboration and investment on trade, research, and harnessing new opportunities is crucial at this moment. Business as usual simply will not do now. Innovation is crucial to increase the resilience and adaptability to fight against
Ms. Aishat, I hate to I request you to please wind up, because we've got more speakers here.
Yeah, both man-made and natural, and to adapt to the new way of life. The regional trade needs to increase, and quota restrictions need to be lifted. Partnerships with private sector and civil society is crucial when we discuss regional collaboration and trade. Expanding and exploiting the fiscal space for financing and stimulating and accelerating clean energy transition is essential at the moment. Recovery policies must be viewed as opportunity to build resilience and increase inclusivity, especially in the context of the changing climate and its adverse effects. Let us commit to ensure cooperation and solidarity at all levels across the countries, region, and international is essential. Let us commit to build better. Let us commit to ensure a progressive and prosperous future where all dimensions of development are taken into account. Let us commit to bring about more inclusiveness and attain equity in the region. Thank you.
Thank you very much, Ms. Aishat Saad. Really enjoyed your talk, by the way. Thank you very much. May I now request Dr. Posh Raj Pandey, Executive Chairman, SOTI in Nepal, to please speak for 7 minutes. Can't hear you.
Please unmute yourself.
Pandey साहब जरा unmute कर लें. Please unmute yourself.
Okay, I've unmuted. Is it okay? Yeah. Okay,
yes,
thank you. Thank you, Professor Akmal Hussain. First, let me join other colleagues to thank Dr. Nagesh Kumar and Professor Sachin Chaturvedi for taking the initiative for organizing this virtual policy dialogue. And in the opening statement, Dr. Nagesh highlighted the impact of COVID in South Asian region. And he also indicated the areas for potential areas for cooperation in South Asia region. And Professor Akmal candidly pointed out the structural weakness of our economy and also our development policy. Here, I'm just going to focus from Nepal's perspective, that is on the state of human cost of the COVID, its socio-economic impacts, and also potential areas of cooperation in post-COVID era. Well, let me touch upon on the state of COVID infection. As of yesterday, that is 8th October, real-time PCR tests were administered to 788,000 individuals. That is about 2.6% of the population. And there were 48,138 positive cases. That is 160 positive cases per 100,000 population, compared to 275 cases per 1,000 population in South Asia. And out of the 48,000 positive cases, 32,964 cases recovered. That is, our recovery rate is 68.5% compared to 78% recovery rate in South Asia. And case fatality rate, CFR in Nepal is 0.6% compared to 1.7% in South Asia. So, from this data, human cost is not bad in Nepal as compared to other South Asian countries. But if we look at recovery rate, that indicates human cost could increase in future compared to other South Asian countries. And in order to contain this infection and the spread of virus, our government has adopted a non-pharmaceutical intervention. That is such as lockdown, prohibitory orders, and restriction on movement. And all these, non-pharmaceutical intervention, they have socio-economic impacts. Well, let me come to this economic impact. The government has not published the official estimate of GDP, gross domestic product, for the period impacted by COVID. And it has estimated GDP for the fiscal year 2019-20. Our fiscal year starts from mid-July. And for fiscal year 2019-20, till mid-July this year, our growth rate was 2.3% compared to 7.3% average 7.3% in past 3 years. So it indicates, there was a decline in the growth rate. But again, if we look at other economic parameters, what I feel is Nepal has already entered into negative growth zone. For that, recently Nepal Rashtra Bank, our central bank, has produced a report on the impact of COVID on economic activities. And that report shows that 61% of industries across the country remain completely shut. And only 4% were able to operate full-fledged manner. And remaining 35%, they were partially operated. And the productive capacity was reduced by 73.8%. And on an average, these industries downsized the workforce by 23%. And they also reduced the wage by around 18-19%. And based on these information, hotel, restaurant, and education are hard hit, with more than 90% economic units were completely shut. But again, health, agriculture, mining, and quarrying sector, they were least affected, and they were, some of them were operational. And again, I mean, if you compare with large and small and medium-sized enterprises, I mean, medium-sized enterprises suffer the more. And again, I mean, if you look at the available macroeconomic data, so, I mean, as Nagesh, I mean, indicated in his opening statement, during this COVID period from April, exports declined by 36.4%, and imports it was declined by 41.8%. Particularly import, I mean, the reduction in import was in capital goods as well as industrial inputs. I mean, that affects our potential and productive capacity. But here the service account, I mean, it has shown, I mean, surplus. But again, I mean, if you look at the, I mean, in detail, then the region could be reduction, I mean, reduce in travel expenditure and education expenditure. And travel expenditure for both migrant worker as well as any student. And again, I mean, there is a reduction in education expenditure. So again, I mean, it's going to impact our future productive capacity.
Dr. Pandey, may I ask you to please wind up because there are two more speakers waiting.
Okay, sure. And again, I mean, FDI has declined, remittance has declined, and the budget deficit has increased. So, I mean, informal employment, which informal employment is 84%, and that has badly impacted, I mean, because of COVID, and most of them are unemployed. And again, I mean, foreign migrant workers, 20% of the foreign migrant workers, they are expected to come back. They are expected to lose their jobs. And again, I mean, in addition, from India, I mean, around 500,000 I mean, migrant workers, they are already returned back to Nepal. So, yeah, I mean, I think, I mean, when we talk about this, I mean, building back better and resilient, as well as regional cooperation, I think, I mean, we need to take into account, I mean, some unknowns. I mean, first, for me, first unknowns is the course of pandemic, its speed, scale, and severity. Are we going to have a second round of an infection, second wave of infection? How is the possibility of mutation of, I mean, virus? Are mutated virus become weakened or become more stronger and deadly? And the second unknown is the size of the socio-economic shock, its duration and trajectory of the recovery. What kind of recovery we are going to have? Is it going to have V-shaped, U-shaped, W-shaped, L-shaped, I-shaped, K-shaped? And the third, I mean, uncertainty, I would say unknown, but uncertainty is the future of regional cooperation in South Asia, particularly after we failed to organize 19th SAARC summit in 2017. And we don't know what would be the appropriate mode of regional cooperation in South Asia. Is it SAARC? Is it BIMSTEC? Is it BBIN? Or are we going to, I mean, form new kind of regional cooperation in South Asia? So and again, I mean, in fact, I mean, regional cooperation in South Asia is weak, and our cooperation's measure are palliative. I just want to give some examples. As reported in Nepalese media, Nepal requested to use SAARC COVID emergency fund to purchase PCR machine, but again, I mean, there has not been any progress, I mean, with this regard. So while talking about, I mean, regional cooperations, I think, I mean, we need to take into account all this bitter truth. And again, I mean, for me, I am born South Asian, and I believe regional cooperation is necessary for us. It's not an option; it's necessity, I mean, for us. And particularly, I mean, I'm speaking from Nepal.
I think that's a very good note on which to.
Okay, so I stop over here. Thank you.
Thank you. Thank you very much, Dr. Pandey. May I now request Dr. Abid Soleri, Executive Director, STPI in Pakistan, to please speak for 7 minutes.
Thank you very much. Good afternoon, ladies and gentlemen. And I think enough has been said about the response, overall response in South Asia, about the kind of pandemic one is facing through. Let me start by saying that whatever the reasons are, we don't know I can't tell you the scientific reasons of it, but this is for the fact that in Pakistan, we are observing a miraculous reduction in new cases. So today it's only 426 cases, 9 deaths during last 24 hours, and since 1st of September, this has been the trend. So fortunately, although every life is precious, fortunately the number of deaths is in single figures, and number of cases they are less than 500. And that actually then leads to two sort of assumption. One is that perhaps we have got herd immunity as a nation, and second is if we do get this sort of false sense of security, we may be hit by another wave of pandemic that can be quite disastrous. But on this note, if I start looking at the last 8 months response, the nature of response of Pakistan, and how does then we connect it with the region, I would say that this pandemic was to be accompanied by two other major blows. One was economic recession, global economic recession, and second was food insecurity. Again, when I look at Pakistan, fortunately, food insecurity has not been one of our major damage or one of the major pressure. Although the prices of wheat flour and prices of sugar, the two non-perishable commodity, they did increase, but it's administrative causes. One can't take it to the COVID, or one can't take it to the pandemic, that due to pandemic there was an abnormal food price inflation or any disturbance in food supply chain. And the third is economy. Again, when I look at economy, I would say that rural economy and agriculture sector has been our life savior. Our economic growth could have been much worse, God forbid, if rural economy was not there to save us. And that is sure that rural economy, it helped in food security as well as it helped in overall economic growth, and to some extent employment opportunities as well. Now, let me come to the region with this context. Now we have three options when I look at South Asia as the region. The ideal situation can be that 8 countries of South Asia, we start collaborating with each other, we come up with some sort of joint strategies, joint South Asian, collective South Asian response, and we deliver on them. We know we are not living in utopia and it is an ideal situation, perhaps it will not happen. The business as usual would be where we can divert our attention from the existing tensions among South Asian countries and try to bring our house in order. So that would be my second best alternative scenario if that can happen, that we stop for some amount of time. We just focus on our domestic issues and try to bring our house in order, each one of us, all the 8 countries. And the third scenario that I can think of, which is my worst case scenario, and that is that more countries, in order to divert the attention of domestic constituencies from domestic issues, enhance this cross-border tension. So we, the think tank community of South Asia, which all of us, by virtue of our organizations, we do have access to decision makers and policy makers. So we need to ponder on these three. Where do we want to go? Now, if we want to go towards this collaborative effort, I would say that perhaps the word South Asia or the word SAARC, it has become some sort of stigmatized. It would be difficult to come up with any South Asian collective response, unfortunately, due to Pakistan and India political tension, but also due to the political tension that prevails among other member countries. So we need to come up with some sort of thematic alliances or thematic areas where we can, 8 countries, they can have a strategy. For example, strategy on floods, strategy on combating flood, disaster risk reduction strategy, food security strategy. So under that thematic, perhaps 8 countries, and if we require 1 or to non-regional countries, they can also join, or some of the countries they can join. But the moment you will give it a hashtag South Asia and South Asian response to COVID, or South Asia health policy, South Asia food security policy, that would, in my opinion, would look good in theory, but rolling it out and implementing it would become extremely difficult. One of the examples that I can cite here is in the case of locust. As Nagesh mentioned in his opening comments, locust did affect Afghanistan, it affected Pakistan, it affected India, it went up to Nepal. Now our 4 governments, we couldn't talk to each other, but FAO, under their regional locust control program, they are having, every Monday they are having meetings where we have one Pakistani expert, one expert from Afghanistan, from India, from Nepal, and they're discussing and Iran, and they're discussing local situation. So maybe we need to think of doable alternatives for regional collaboration without losing the spirit of what Poshraj Pandey said. And I too like Poshraj Pandey. I'm a proud South Asian, but without losing the spirit of South Asian collaboration, we need to think of alternative forums, or we need to think of some of the existing forums which we can actually operationalize. Now, the couple of other things where we can focus. One is clean recovery. Of course, all of us, we are talking of building better, but in order to build better, this is the time where we can focus on clean and green building better. And I'm sure that Nagesh office can play a pivotal role in it. Most of the recovery operations which would be done, whether to improve the public health infrastructure, whether to improve the non-COVID disease infrastructure, whether to improve our social protection. So we need to think of the clean ways of doing things. Another point where we can collaborate with each other is our social protection. Nagesh again mentioned NAREGA and ESAS program. Excellent program. One of the positive things that I can see coming out of this whole situation, that in Pakistan, we have started talking about universal social protection now. And there are already some policies on board that some pilot universal social protection schemes can be started with the most marginalized districts. So maybe one district in each province, but providing universal social protection in case of health emergency and in case of unemployment. So I think these sort of things we can again exchange our success and failure stories with each other, and we can try to come up with some sort of combined strategy. And finally, I would focus on the opportunity that is there, and that opportunity is the fiscal inclusion. We have been talking of 4th industrial revolution. We have been talking of digitalization and digital transformation of our economies and our societies. But I would say that in South Asia, we took a quantum leap in catching up with the 4th industrial revolution. We're still far behind among developed countries, but at least in developing countries, if I can see. So because of the available digital infrastructure, which was already in place now, from telemedicine to online education to online food deliveries and online tailoring service, all sort of things now they are available online. And I think there is an opportunity for many of our small and medium enterprises to come and to work. Another good thing that COVID-19 has provided us, that we have realized that we don't require those spacious offices and huge offices to carry on our work. As TPI, we are working from home till 15th of September, 100 plus staff members. They are efficiently delivering on their work. So the real estate mafia that had been charging horrendous amount of rent, I think we can promote this new ways of doing work, and we can try to find this opportunity out of COVID. And finally, the whole debate on the lockdown versus smart lockdown versus micro smart lockdown. I would say that Prime Minister of Pakistan, he's a risk taker, and he played a gamble when he said smart lockdown, which meant selective lockdown, and he kept most of the sectors of economy moving. And once we saw that COVID new cases, they are reducing, we went for full-fledged operations, and economy didn't take much time to respond. So all the economic activities we were able to actually continue. Rather, we are sort of over continuing those activities, and that's where my concern is that there may be a second surge. And now we are adopting the policy of micro-smart lockdown, that wherever now a COVID case gets discovered, only that street or that house gets locked down for the 14 days, not the whole mohalla or whole community. So I think these are, there are some success stories, there are some failure stories, there are certain things where we couldn't do better that we need to share with each other. And I'm thankful to UNESCAP for organizing this extremely important webinar. I would request Nagesh that if you can have some pointed questions that you can send us in email so that you can come up with the policy paper out of it from all 8 panelists and Dr. Akmal Hussain Saab. So you can try to come up with a set of policy recommendations and a policy paper, what worked and what didn't work in which country. And I look forward to learn more from our neighboring nations. Thank you very much.
How to take things forward. Thank you very much, Dr. Saleri, and thank you also for your very useful suggestions on how to take things forward in this particular forum. May I now request Dr. Dushni Veerakoon, Executive Director, Institute of Policy Studies in Sri Lanka, to please let us have the benefit of her wisdom.
Thank you. Thank you, Dr. Hussain. I always notice that Sri Lanka comes at the tail end of these South Asia panels. So I'm going to be very brief. I think a lot has been said, and many of the experiences across our 8 countries seem to be very similar. So, and even in the opening remarks, I think the key vulnerabilities were touched on. Just to lay the sort of the upfront COVID conditions in Sri Lanka, I think we've done reasonably well in containing the health hazard. Sri Lanka has just over 3,100 infected patients and 12 deaths, and more or less life is back to normal for us. We are moving about freely. Everybody is back at work now for more than 2 months. The only risk that the country has is in Sri Lankan migrant workers overseas who are waiting to return. Many of them are infected, and that is the big challenge for the government in terms of providing them adequate testing and health facilities. I just want to focus on policy side, because in looking at the economic fallout, I think for all of us, it's pretty much the same story. And I think at this point, perhaps numbers really don't matter. Whether the economy contracts by 3 or 10%, I think recovery is really going to be a key challenge. And interestingly, I think when we look at the South Asian region and prospects for regional cooperation, I think that would have been stronger if all the countries had been overcoming the health crisis at a similar pace. That would have allowed for tourism and borders to open, but given that the region has still not got the health situation under control, I think in the areas for cooperation will really come about in the recovery phase. And I want to touch on 2 aspects. One is on the macro, on the fiscal side. Both Nagesh and Dr. Hussain mentioned that the region has to spend on universal health, universal education, on universal basic income, etc. But all these require that we have to re-examine what our tax and spend policies are. At the moment, I think the mindset is do whatever is possible to avert a major economic crisis. But at some point, the reckoning of how are we to raise resources for the money that has been spent, and how to ensure that the recovery process is resilient means that we have to look at some of these areas, and I think hard decisions have to be made. South Asia has really had a poor record in terms of managing its public finances. And there, I think even when we look at the thinking on macroeconomic policy, fiscal policy has come up as a key intervention now, rather more so than monetary policy in tackling COVID. So what are the policy choices for South Asia? All 8 countries are in a similar sort of situation of having very low tax collections and not having sufficient monies for the spending that's required for health, for education, for social protection, and all of that. So I would say that is one area in which us as researchers, as think tanks, can perhaps start to look beyond the immediate macro policy choices and look at the recovery phase and how our governments can deal with it. Second area is on trade. I think it came up in the first presentation also that countries are instinctively looking inwards, and that is not surprising given the extraordinary set of circumstances. But it also means that we are, in some sense, closing up our economies. Sri Lanka has imposed certain import restrictions, etc. The message is that we must be self-sufficient in food production. But again, beyond the immediate emergency period and the emergency measures that we've taken, will that same thinking and mindset become entrenched in the South Asian region? I think for many of us, we are comfortable behind borders that are protected. But again, I think for the think tanks and researchers, we need to perhaps be proactive in coming out with common positions on what our trade policies might look like once the immediate crisis recedes. And related to that is, I think, the whole discussion and debate that's going on around supply chains, that these supply chains, as was mentioned, they are being reset because of the disruptions. Supply chains are bound to be a little more compact now and to be a little more concentrated regionally to sort of mitigate large-scale disruptions of the kind that we've seen during the COVID period. So again, opportunity for South Asia to look at specific sectors, particularly in the food production sector, for instance, whether there is potential for greater supply chain cooperation. We talk of a SAARC food bank, and even during this crisis, I have not seen any country making use of that, though there have been instances where food security has been an issue in these last 3-4 months. And in the last, sorry about that. Since I've taken 1 minute to sort that out, I'm just going to wind up now. Related to that is, for me, institutions. What are we doing about institutions in the South Asian region and in our own countries? Whether it's the delivery of public services or putting our fiscal public finances in order, institutions matter. But in the current emergency sort of measures that we've taken, we see that governments are playing a much more proactive role. There is a sense of state-led development processes coming in. But what does that mean for us going forward? Should we, as a region, look at how we can strengthen and ensure that our institutions stay strong and resilient in the recovery beyond COVID-19. So those three areas I see as critical for South Asia on macroeconomic policy, particularly on fiscal policy. Second is on trade, and third on institutions. I'm going to stop there. My 7 minutes is up.
Thank you very much for a fascinating presentation, Dr. Veera Kuhn. I think we've arrived at the end of a really very intellectually stimulating set of presentations, each based on deep analysis of the impact of COVID-19 and in making the suggestions for how to get out of it better. I think what is common to all the speakers is their powerful sense of humanity, which is the basis of suggesting policies for getting out better. Now we have a number of questions from the audience, but given the shortage of time, what I thought I would do, if you agree, is to select 4 of the key questions that have been posed by the audience, very fertile questions. And I will leave it to, one of them is actually specifically pointed to Bangladesh. You know, there it's very clear who will respond, but there are 3 others of a more general kind, and I would invite the panelists to volunteer to answer those questions. Can you hear me?
Yes, we can hear you.
Okay. The first very fertile question is, what has been the role of multilateralism in terms of handling the crisis? In other words, to what extent has the international community succeeded or failed in handling the crisis? I mean, the international community as institutionalized in multilateral organizations. Would somebody like to field that question? Abid, Dr. Abid Suleri, would you like to have a go?
Yeah. You know, in case of Pakistan, when we look at the role of multilateral organizations, there can be 2 ways of looking at it. One is, for example, that energy tariff, Pakistan is under an IMF program, and being under an IMF program, it has to comply certain conditions. Of course, when as I said, our own house is not in order due to energy sector debt that is piling up, IMF would definitely ask for some increased energy tariff so that we can clear energy sector debt, and the whole blame goes on the organization like IMF, which sometimes I do feel that it is unfair to blame them. It is our own weakness that we have been piling up this energy sector debt for years. But then there is another aspect of it, and that is that all sort of fiscal stimulus that we gave, it was due to $1.4 billion that Pakistan received as one of the earlier countries under this IMF rapid finance instrument. As soon as COVID started, we received that $1.4 billion, and we actually then used that money for providing subsidies, not only energy subsidies, but also the credit to industry and SMEs on very discounted rates. So it is a mixed role that those multilateral organizations they are playing. But main thing is preparedness at a domestic level. And I would say that if you are prepared enough, I don't think multilateral organization, they can do much of arm twisting. And if one is not prepared, then of course, sky is the limit for them.
Yeah, thank you very much, Dr. Abid. Just to take this question, to explore another dimension of this question, and perhaps Sachin may want to address this. And that is that, you know, in country after country in South Asia, it's been suggested that the capacity to respond to the pandemic was constrained. Hello? Hello?
Yeah, we can hear you. Please go ahead.
You can. My exploration of the second dimension of the question is that in most countries of South Asia, it's been argued that the capacity to respond to the pandemic was constrained by the fiscal crisis that many of these countries were facing. And in this context, when you talk about multilateralism, one of the proposals that could be made is for some kind of debt relief or debt write-off for those countries who are in an acute situation of debt servicing, where debt servicing, for example, in the Pakistani case, occupies 45% of the 55% of the total tax revenue, and therefore leaves very little fiscal space to do anything serious about providing universal services of health and education and so on. And perhaps somebody could respond to that possibility of whether the region or the developing countries can, as a whole, can persuade the multilateral agencies as well as the bilateral agencies who've given loans to South Asian countries, whether they can, in the extreme cases, be written off. For there's often a kind of trade-off between human life and debt servicing, and therefore I think it may be worth exploring this question. I don't know, Sachin, would you like to comment on this? Dr. Fahmida Khatun, would you like to comment? Anybody? Dr. Dushni Virakun?
I think there is Sri Lanka is one of the, I think, most highly indebted countries in South Asia, that we have a very high dollar-denominated debt servicing for the next 3-4 years that we have to deal with, and it has already asked bilateral lenders for debt relief as well as multilateral lenders, and asked IMF for some emergency assistance. I think it relates to the earlier question that was raised about how effective are multilateral financial institutions in this crisis, and to me they're not. There is in some sense a vacuum in global leadership to deal with COVID-19, and we see that in the blame game and the retaliatory tit-for-tat economic sort of sanctions that countries are threatening each other, etc. And in that context, the IMF, the World Bank, etc., to come up with a debt relief package, I think they've been rather slow. And and it's I think fair enough that the low-income countries should be offered that first and then scaled up. But as far as I can see, that sense of urgency to address this issue is really not there. And I think that the South Asian region can make a strong case for it on behalf of developing countries, particularly with countries like India that are also lenders in their own right now. Sri Lanka has approached India, for instance, for debt relief at a bilateral level. So if India does take the lead, I think there's a very good chance of the region making some kind of an impact at the international level.
Excellent. Thank you very much, Dr. Virakun. There is a related question, the second question, and perhaps Nagesh could have a go at it, and that is that SDGs will take a backseat if the fiscal crisis continues. And so, can there be some kind of financing mechanism, whether it's a regional financing mechanism or some other multilateral financing mechanism, to continue to pursue the SDG goals agenda in South Asia?
Thank you, Akmal. I think this is a very important question, and this is a very big challenge that everyone is facing. Whether the diversion of resources to meet the challenge of COVID will affect the progress on SDGs, and there is a real threat of that happening. But this is what exactly this discussion is about, that we should do these stimulus packages in a manner that they achieve the sustainable development goals as well. And you have rightly said that universal basic income, and if we are able to ensure universal social protection and health and through basic income or whichever means, this is achieving SDGs. So we need to find ways to join the stimulus packages to deal with the crisis in a manner that they also achieve SDGs. And about the financing discussion that was taking place earlier, I think there is a global discussion on global debt restructuring. And in G20, there is a sort of moratorium agreed to for LDCs, and Pakistan is part of that. So there was yesterday also a big meeting of financing for development in the United Nations, which is a process started by Prime Minister of Canada and Prime Minister of Jamaica, and many countries are involved. Pakistan, Maldives, Bangladesh, Japan are the 4 countries from Asia which are co-chairs of the groups under this discussion, but all others are also participating. And so there is an active discussion at this moment in United Nations financing for development, as well as in G20, and hopefully some more initiatives will come to take care of the challenges that financing is really becoming a big challenge for SDGs, as well as for fighting this or mitigating the crisis right now.
Thank you. Thank you very much, Nagesh, for updating us on these hopeful developments within the global community. Okay, may I now come to the third very interesting question, and perhaps we can ask, if she so wills, if we can ask Dr. Fahmida Khatoon, from the CPD, is like one of my intellectual homes. And so I'm very pleased to see Dr. Fahmida representing CPD Bangladesh. May I request her to try to field the following question, and that is related with the gender gap. What would be the strategy for overcoming gender gaps created by COVID-19? And
thank you very much.
This is closely linked with the fourth question, if you may want to do the two together, which is how have women's labor in the government in the garment industry, how is that going to survive in Bangladesh?
Thank you, Professor Akmal, and those words also regarding CPD. So this is a very vital question, actually, and as you know, during any crisis, women are the most vulnerable ones. They get the hit more than any other sections of the society. And during COVID, during my presentation, I touched upon the educational aspect, but even in case of health, in case of domestic violence, in case of labor market participation also, women had been mostly sufferer. And in case of the labor market, if you look at the labor market composition, that in Bangladesh, 85% of the employment is in the informal sector. And in case of women, it's more than 90%. So during COVID period, when there was lockdown and even now with limited economic activities, the most vulnerable sections had been those who are in the informal sector, and mostly women, those who were involved in activities on a daily basis, and also activities without any job security or at a low income rate. And as we know that the garment sector is more or less, you can say, semi-formal. So during the, because of the hit on the exports, ready-made garments exports, the labor demand has declined. And what is happening in fact, before COVID also, what was happening, there was a transformational change in the sector, that the use of technology was increasingly becoming more evident. And since women workers are at the bottom of the ladder, and they are less skilled, less educated, so they were the first one to be laid off. And with COVID also, we see that many of the women, they are also now going out of this job market. So women will be affected. And as I have mentioned in my presentation also, that Bangladesh's achievement in terms of women's empowerment through various activities, starting from microcredit and then this RMG sector, many of these achievements will be actually reversed. And we are observing that already. So the COVID recovery phase will have to actually look at the women's requirement and women's need. And what will have to be done is that when we think about reskilling and upskilling and adoption of technology, so women have to given a priority, firstly, and secondly, many of them will not be able to come back to the labor market even after COVID, even when the economy recovers. So many of them will have to be given the opportunity to be self-employed, to be involved in the micro and small entrepreneurs. And even during COVID, these MSMEs were affected more, and more so those were owned by women entrepreneurs. So during the COVID recovery should include support to women, access to finance by the women, and also that the opportunities to have the market for their products. So I think two activities together will have to go in parallel, in tandem, that women's empowerment, women's skilling, reskilling, education, and also women's opportunities for self-employment in the small and medium entrepreneurs.
Excellent.
Thank you.
Thank you so very much for your, very thoughtful response to that question. And I'm very impressed by the way you mobilized different concepts and different kinds of evidence to bear in providing us an insight into the question itself. There's one last question which I'll leave to the panel to address. It's a new category of questions, and that is related with the implications of population dynamics, such as migration, on controlling and recovery from the COVID-19 pandemic. In other words, what role have population phenomena like population dynamics such as migration got to play? What kind of role has it played in the attempt to recover from the COVID-19 contagion? MS Aishat, would you like to have a go on population dynamics?
Thank you. In our country, we have experienced, as I mentioned earlier, like it's 1/3 of the population is residing in the capital Male, and the government has been doing some work to create less dependency on the capital and trying to promote outward migration into more of the, and developing some more cities across the country as well. And we have experienced that due to COVID, we have had outflow of outward migration into the original place of residence by many of the residents of the capital. And this has created some, and also since Male or the capital was locked down, for many of the services, people were not able to come to Male, which they usually come to, like hospitals or trade, these affairs. But people are now, since Male is still under lockdown, people are traveling to other cities or populated areas to get these services and experiencing these services, and they have now gained confidence in understanding that it's not that bad actually. And many of we had schools locked down before we went to a full lockdown. So many of them, they had traveled back to the islands, and then all the children who are residing in any island can go to the school that is in their island. So they're registered somewhere or continue education, they can continue at the place of location. So this has given some people to experience that education in the islands or more rural areas are not actually that bad, but it's just a conception that we had that things were better in the capital. And also this is very much related to the health sector as well. We have had regional hospitals that were so underutilized all this time that we are now having people traveling for deliveries was very common to the capital. Now, since the capital is still under lockdown from other islands, they have to make do in other rural areas, and we have had a very positive feedback from the people. So they're just reluctant to have no confidence in these services, so assume that they were not good enough for them. So some hospitals, they have reported they have had births in the past 4 months where equivalent to the 4 years of operating hospitals. So this, I think, is a good opportunity for the government to revert migration and into more rural areas. And also we have seen trade can be facilitated through online platforms and also down the middleman and really reaching to the farmers or fishermen within the rural area, so we could buy directly from them or communicate with them directly instead of having some middle person engaged as well. So these and many of the resort workers, since they've been laid off or sent away on leave because all the resorts are closed, they have engaged in farming or other economic activities within their islands and started exploring new talents or hobbies like growing food or making things, crafts and handcrafts they have not attempted before. So this also has, and they're using online platforms like Instagram to be reaching out to people and selling this stuff on WhatsApp and Viber. So these are platforms that opportunities that COVID has brought us into the country. So as I mentioned earlier, we have a very high youth population, and these changes are more embraced easily by this cohort of age group, I would say, and more technology savvy. So it's the transition is not that difficult and not too sudden for them as well.
Thank you. Thank you very much, Aishat Saad Saiba. Now, the kind of discussions that we've been having during this webinar have three very important features. The first is the depth of the analysis at the individual country level. I think it's very unusual to have this kind of deep, incisive analysis at the country level of a relatively recent phenomenon, which is the pandemic. The second interesting feature of these discussions has been the kind of proposals at the country level that have been made to come out of this crisis better. And they have varied across countries, but each one of the proposals made has, there's a lot of thought that has gone into those proposals, including Abid Suleri, who I think now has begun to believe, like most economists, in the efficacy of the second best, the art of the second best. So he's given his own very interesting take on how to respond to this crisis at the country level, perhaps. And the final very interesting thing, and it came out at least in some of the presentations, and particularly Nagesh's magisterial overview of what the region is facing. And that is the kind of regional collaboration or regional cooperation measures that can be undertaken both to create resilience against future pandemics or natural disasters, and also to come out of this crisis better at the economic and social level. I will close by the observation that I'm really missing my revered teacher and now co-chair of SASEPS, Dr. Deepak Nair, who unfortunately couldn't attend, because he has this remarkable capacity to pull the threads together of a diverse argument. So I can only, give you a second best attempt, and that is, I think, overall what's come out of this webinar is that South Asia, it might have a great variety in the degree of vulnerability, but South Asia as a region is highly vulnerable to pandemics as well as ecological disasters. And on the question of resilience, of how to reduce that vulnerability, there are four fronts on which individual and collective efforts have to be made. The first, of course, is the universal provision of quality healthcare to all citizens. The second is the universal provision of social protection to all citizens. The third, I think, is the universal provision of a basic income as a kind of backup or cushion to prevent people from starving following a lockdown. And I think the fourth one is that in coming out of this crisis, we have to chart a new trajectory of economic growth, where economic growth, instead of being based on inequality as it has happened over the last 7 decades, the economic growth of the future in South Asia has to be based on equality. It has to be based on unleashing the potential of all of the people rather than a few, to enable the middle classes and the poor to contribute to innovation, productivity increase, investment, and thereby become active participants in the process of growth, rather than being merely the recipients of a trickle-down effect of growth by the elite. And if the middle classes and the poor begin to participate in the process of growth as active subjects, then you will have equality built into the growth process. And I think that's what we need to think about when we are charting a new trajectory of economic growth. I'll end there by thanking everybody for fascinating presentations, and also particularly to Nagesh and Sachin for having organized this superb webinar. I think we could, in line with Dr. Abid Suleiri's suggestion, ask Nagesh to coordinate brief essays by each of the participants, which could perhaps be brought together in a either a monograph or even a longish paper on South Asia, depending on the length of the individual inputs. But I would request Dr. Nagesh Kumar to sort of follow up and see if he can coordinate contributions to be made by each one of us who's been present here. Thank you very much, everybody. Take care and look after yourself.
Thank you.
Thank you very much. If I could take 1 minute to just thank everyone from the bottom of my heart for giving your very valuable, very insightful and thoughtful, remarks and contributing to this very rich discussion. Akmal, you have done a great job in moderating this panel and adding your own insights. I like the way you put that equality has to be at the heart of new sustainable high growth pattern in South Asia, and regional cooperation, everyone has said, is very important. Is the dialogue over?
Sir, it's just conclude.
Regional cooperation has to be an important element of that growth, and universality of social protection and universal education and health will be very critical for taking South Asia to the next stage in coming out of this crisis and building a much more inclusive and resilient societies. So there are many very important thoughts coming out of this discussion, and as you have all suggested, we will try to put them together, and we will be in touch with you and to bring out a monograph out of this. I think everyone has recognized the importance of South Asian cooperation, working together. But Abid, I like his thoughts on the the challenges that the existing institutional infrastructure architecture faces, and what we need to do in this current context is to promote sectoral cooperation on specific sectors, and there perhaps UN agencies like FAO did about LOCUS and ESCAP and all others could perhaps push this cooperation on sectoral basis, and that might be building kind of a confidence among the countries in South Asia to talk to each other for doing more in terms of cooperation. So on that note, thank you very much once again, every one of our speakers today, and we will remain engaged, and this is the beginning, not the end of our brainstormings on this theme. So we will continue to remain engaged, and a publication will come out of this discussion and will be circulated to all the people who participated in this, and will find other ways of disseminating data also. So thank you very much once again to our speakers, our moderator, Akmal, and all the audience who have put some interesting questions. And we all agree with Akmal that we missed Professor Deepak Nair today. And I'm sure next time when we have this discussion, he will be with us. Thank you very much once again.
Thank you.
Bye-bye.
Thank you.
Bye-bye. Thank you.
All the best.
Bye.
Bye-bye.
Thank you.
Yeah.